Hi, listeners. I'm Lindsay Smith Rogers, producer of Public Health on Call.
And I'm Annalise Winnie, a journalist and editor for Global Health Now. At the beginning of the pandemic, there was a subset of people who saw the opportunity of remote work and cheap airline tickets to explore places they always wanted to go. But this also meant that many destinations that rely on tourism dollars had to weigh economic stability against the risk of COVID outbreaks from tourists bringing SARS-CoV-2 from home.
Tourist destinations like Aruba, Jamaica, Hawaii, and Senegal may not have had the resources or infrastructure to care for an influx of COVID patients. And now that more people are vaccinated, are these areas eager to welcome back tourists? After a seismic shift from the pandemic, how are some of the world's most popular destinations looking at tourism differently?
In this special episode of Public Health in the Field, we're taking a virtual tour through a few tourism hubs to find out. First stop, Aruba.
Aruba, Jamaica, ooh, I wanna take you. Bermuda, Bahama, come on, pretty mama. Key Largo, Montego, baby, why don't we go? Jamaica, off the Florida Keys.
Aruba is an island about 430 miles south of the Dominican Republic. It's one of the ABC Islands, along with Bonaire and Curaçao in the Caribbean Sea, and is an autonomous country in the Kingdom of the Netherlands. At just 21 miles long and 6 miles wide, Aruba is home to around 110,000 people. The primary industry is tourism, and every year prior to the pandemic, this tiny tropical island welcomed nearly 2 million visitors. But in 2020, the island closed its borders to all non-residents and did not reopen for several months. Hotels and restaurants shuttered, workers were laid off, and when restrictions were lifted to allow tourists back in, numbers were sparse. In all of 2020, just under 300,000 people came to Aruba, a place used to the dollars from 2 million tourists. Ricardo Velasquez was born in Holland and raised in Aruba. He currently lives in Atlanta, but his parents still live on the island and he has residency there. He's been back twice in the last couple of years, and he still has deep ties to the island he calls home. Rick says that in economic terms, Aruba relied heavily on the Netherlands for support.
I believe Aruba was only able to last a few months after they basically shut down the island, given that the economy is so dependent upon tourism. They ran out of money fairly quickly and had to seek support from Holland and other countries as well for money to be able to get food on the island and just basically have the government continue to run.
In addition to financial support, Holland also provided COVID assistance. The island has one main hospital with 320 beds to serve all 110,000 residents. Before the pandemic, the facility had capacity for 6 ICU patients. Thanks to support from the Netherlands, by April 2020, the hospital had expanded its capacity to 33 ICU units. Throughout the pandemic, Aruba has had to send some of its ICU patients to Colombia, an air ambulance trip of under 2 hours. Many of those patients were not COVID patients, but victims of traffic accidents and other injuries who required ICU care, but not necessarily ventilators. This arrangement helped keep the hospital from overflowing even at the height of COVID infections. The first reported case on the island was on March 12, 2020, and early cases were mostly imported cases from tourists or residents arriving from abroad. After closing its borders and instituting mandates similar to other countries like curfews, a ban on gatherings, and staggered hours for at-risk groups in grocery stores, the country saw no new cases until the end of June of 2020, and even then, single-digit case counts for weeks. But in July of that year, the island began a phased reopening to international tourism, which included mandatory testing and quarantining. By early August, there were nearly 90 new cases per day, in part because, according to Rick, some of the protocols weren't strictly enforced.
There was a quarantine requirement until you received your test results. However, the enforcement of that wasn't very strict. So you had tourists arrive, get tested, and they were able to go ahead and go to their respective hotels and told to stay in their rooms until they got the test results. But unfortunately, there wasn't much enforcement done to ensure that that happened. You arrive your first day on the island and you want to go have a nice sunset dinner. To stay in there might be a stretch. So once a test came back and they were cleared to proceed with their vacation and kind of no longer have to be in quarantine. If you did test positive, you were then brought to a designated site to then stay for 2 weeks until you were symptom-free or tested negative.
This isolation site isn't free, nor is COVID care on the island. Every tourist is required to purchase a daily insurance that covers medical and non-medical expenses if they test positive for COVID. This mandatory non-refundable premium is $15 a day, paid in total before your travels. So if you're coming to Aruba for a 7-day vacation, you would pay $105 upfront in addition to any other insurance you might have. At first, tourists were slow to come back to Aruba. Pre-vaccine, the quarantine and testing requirements made travel seem more cumbersome. And Rick says only about a fifth of the open hotels on the island were fully occupied during the high season. The impact on residents was palpable.
You're talking about 70% to 75% of the population depends on a job in tourism. So you're talking about all those people out of jobs. The unemployment benefits were certainly there, but at some point, the Aruban government doesn't have any more money.
Rick said that many Arubans had to accept the risks associated with opening tourism and relaxing requirements. By the following summer, 2021, tourists started coming back in droves. Rick visited his parents for the first time during the pandemic that summer in July. By that time, Holland had provided Pfizer vaccines to residents of Aruba. Now, about 80% of the country is fully vaccinated. And once the island recovered from a huge surge during the Omicron wave, things are starting to look as they once did. Rick said his family has seen some promising signs.
If I'm not there, I can always tell how busy things are by the amount of times my mother complains about the ATV tours that drive by the house and sprinkle up dust through the window. So she has been complaining quite a lot. So that's a great sign that more tourists are on the island, taking part in these tourist activities. They see a lot more catamarans being active on the water, which is also a great sign. And restaurants being full again and opening back up. So these are all positive signs that the island is coming back.
In Jamaica, some 600 miles northwest on the Caribbean Sea, Usher is relieved to be back at work on the legendary 7 Mile beach in Negril. It's in the heart of what's known as Jamaica's tourism corridor. Usher works for Captain Quality, an independent company providing tours, snorkeling excursions, and boat rides to the throngs of tourists who visit the island every year. He loves his job, and since Jamaica nixed all tourism restrictions in April, things are starting to feel like they're getting back to normal, if slowly. 3 years ago, as the pandemic started to take off, he wasn't sure if that would ever happen.
Nobody knows when, things will get back into normal. You have to do something. You had to put something in place because people were panicking. It was so crazy.
When COVID closed Jamaica's borders to tourists in March of 2020, it hit the economy hard. And it was a stark contrast to how things had been trending for years. Leading up to the pandemic, Jamaica's tourism industry was experiencing record growth. The island had more than 4 million visitors in 2019, bringing in $3.3 billion in revenue. That year, 1 in 4 Jamaicans worked in the tourism industry. But from 2019 to 2020, tourism's contribution to Jamaica's GDP plummeted from 28% to about 12%. And just before the pandemic, the government had laid out a 5-year plan to expand tourism even further. COVID put all of that on hold and put some 120,000 tourism workers out of a job. Usher was one of them. In those early days of the shutdown, he says the scariest part was not knowing when it would end. Amid supply chain shortages and panic buying, supermarkets were cleared out and there wasn't money to buy from them anyway. So Usher made a hard pivot, turning to farming and fishing to feed his family. Those were skills he'd learned as a boy. They prioritized staple crops like yams, plantains, and tomatoes, and spearfishing, which was once a hobby, became a crucial means of putting food on the table.
If you don't have no money to buy, you have to find other options. You have to go fishing. You have to go spear shooting, shoot some fish. You have to do something. Because, remember, the family got to eat, you have to just keep alive,
He was grateful to have a skill he could put to use.
It was a learning process, as in, I was trying to keep surviving, It basically, helped you to understand and appreciate things more and, knowing that, if you're in a situation again, you would know how to get out.
And more than ever, people in the community counted on each other to get by, checking in on their neighbors and exchanging goods.
It was basically like, helping out other persons because, it was like basically planting and who could give this, give that, and then you get back something from somebody. So it was like exchange for exchange. Since the pandemic, more people started doing it on a wider scale.
But when Jamaica reopened its borders to tourists in June of 2020, after almost 4 months without tourists, Usher was more than ready to welcome them back. Mask guidance and weekly testing requirements for tourism workers felt like a small price to pay. And when they became available, so did vaccines. The first COVID-19 shots arrived in Jamaica in March of 2021, making the island the first Caribbean nation to receive doses through WHO's COVAX program, which aims to ensure equitable access to COVID-19 vaccines. Things opened up even more in the summer of 2021, when many visitors to Jamaica were vaccinated, but many tourism workers still weren't. Even Usher, who had no qualms about getting vaccinated, didn't get his first shot until April of this year. The rollout was slow because of limited doses and also because of vaccine hesitancy, which has been driven in part by deep vaccine skepticism within the influential Rastafari community. One global Gallup poll found that in 2020, Jamaica had one of the world's highest rates of vaccine hesitancy, with just 32% of Jamaicans saying they would get their shots. That's well below the 60 to 70% recommended by WHO to secure herd immunity. But for his part, Usher is grateful for COVID-19 vaccines. He says they gave him back his livelihood.
I'm 100% happy. This is basically the main income for majority of the persons who live in the neighboring community. And then, you hear all you need to do is get vaccinated and do the right thing. And then, we're good to go. People was like excited to do, to get it back on track.
5,000 miles west in Hawaii, the return of tourism is bringing up some bittersweet feelings. The pandemic has been a huge hit to Hawaii's economy and tourism workers in particular. But it has also pressed fast forward on something Hawaiians have been working toward for some time, a chance to rethink hospitality in a place that prides itself on the spirit of aloha.
So aloha is probably the best known word, but also the most misunderstood word in the Hawaiian language. It means hello and goodbye. Those are the ones people know, but most importantly, at its core, it means love. And the aloha spirit is something that has existed in Hawaii so long as I know and has been touted not as a tourism message, but as something that everyone here lives by, whether or not they're Hawaiian. And I want to make it clear that this is something that is meant to be shared, but is oftentimes exploited instead.
That's Madeline Lehulani McKeag, a public health student here at the Bloomberg School who also studies law at the University of Hawaii at Manoa. She says that people come to this tropical paradise expecting an escape from reality. But especially in a pandemic, that can come at a heavy cost to Hawaiians. She has 2 uncles who lost their tourism jobs in the pandemic, and it was hard to watch. But she says, despite the struggle to make ends meet, there was also a sense of relief.
Over the past 2 years, for the first time in 50 years or something, we've been reminded of what this island used to be like without tourism and when it used to be just us. And I think a lot of people miss that.
As in Jamaica, before the pandemic, visitors to Hawaii were growing at an astonishing and perhaps unsustainable rate. In 2019, Hawaii saw a record 10.4 million visitor arrivals, and the island had been building toward that for several years. Beyond the hundreds of thousands of jobs it brings, in 2019, the amount of state tax revenue from tourism alone was enough to pay for public education in Hawaii. But with bargain vacations and cheap flights, the cost per visitor was also dropping. So the growing crowds and strain on the island's resources weren't met with proportional economic gains for the industry. At the beginning of 2020, before the pandemic took off, tourism authorities had already changed tack, releasing a strategic plan that focuses less on mass marketing and growing visitor numbers and more on what the Hawaiian Tourism Authority calls destination management. That aims to balance the health of the economy with the health of Hawaii's people, culture, and the island itself.
For over 100 years, the role of the Hawaii Tourism Authority and its various predecessors was to promote Hawaii as a visitor destination, to market Hawaii as a visitor destination. That focus has shifted. We are now about destination management and visitor education. Part of destination management is understanding that this is not simply a destination. This is home. For 1.5 million people, this is home. For some people, this has been home for many, many generations.
That's Elihia Gianson, Public Affairs Officer at the Hawaii Tourism Authority. Initially, a lot of the thinking behind that plan had been to mitigate the impacts of climate change and to protect sensitive natural resources. The pandemic added a whole new dimension to the need to rethink how Hawaii balances tourism with the needs of its people. For one, the pandemic has hit indigenous communities disproportionately hard. In Hawaii, non-Hispanic whites and Native Hawaiians and Pacific Islanders have higher rates of COVID-19 than other racial and ethnic groups. Hawaiians also have some of the highest rates of multi-generational housing in the U.S. That's a lifestyle many Hawaiians are proud of, but it can also come with the added stress of potentially exposing vulnerable elderly relatives to COVID. Plus, the spiraling cost of living has led to more overcrowded housing, again upping the risk of infection. About half of Native Hawaiians no longer live on the island, in large part because they can't afford to. Hawaii has some of the highest costs of living in the U.S., with houses in some areas averaging around $1 million. That's out of reach for most people in the tourism industry, where salaries average around $40,000 a year. Bolstered by the pandemic and remote work, the takeoff of the digital nomad lifestyle has made some visitors permanent fixtures far beyond the confines of resorts, further driving up costs in Hawaiian communities. So, however much people come to Hawaii expecting utopia, an escapist experience doesn't match up with what Native Hawaiians experience day to day, nor with the island's history, which has been marked by imported illness. McKeag explains.
Something that I don't know if a lot of people know is that we were contacted very, very recent when you think about world history. It wasn't until 1777 that any white outsiders had discovered the Hawaiian Islands. And that's important to know because within the first 100 years after contact, the population was cut by 90% due specifically to disease from outsiders. And that, I think, makes us extremely fearful now of letting people back in because we know how vulnerable we are because we've come so close to complete devastation already.
That history has embedded in Hawaiians a sense of self-preservation that's driving a new approach to tourism.
As the native people of this place, there's a responsibility as host. If you have a house party, you're not going to let everybody else do the dishes because it's still my house. This isn't a get out of here, you're not native. This is okay, you're here at my house, so we're going to make sure everybody's all good.
What does that look like in practice? Reservations are now required at the legendary Diamond Head State Park, where before the pandemic, tourists would often gather in huge crowds at sunrise. In places like Kauai, there are efforts to cut back on car rentals in overcrowded hotspots, and to instead use reservation-based shuttle services. Honolulu has toughened restrictions on short-term vacation rentals like Airbnb. And today, the leadership of Hawaii's Tourism Authority has more Native Hawaiian presence than ever before, and that is sure to inform the future of tourism in Hawaii.
We've been talking about aloha for over 100 years as the most important value you need to know when you come to Hawaii. We're introducing folks to aloha's sister value, mālama, which is to care for, to nurture. When we invite folks to visit us here in Hawaii, we want to leave with them this value of mālama so that they can take it home and care for their own home, wherever it is.
Pandemics are nearly impossible to predict. But it's also true that many places that rely so heavily on tourism dollars are also incredibly vulnerable to other climate change disasters like hurricanes, floods, and fires. These places also tend to have lower overall incomes and well-being indices, and tourism dollars often don't wind up in the pockets of locals. Sedina Fall is a researcher at the Johns Hopkins Carey Business School who has looked into the impacts of tourism on local economies. Specifically, his research focuses on Senegal in West Africa, a small country of about 17 million people that's a major tourism hub thanks to its miles of coastline, rich cultural history, including 7 UNESCO World Heritage Sites, and close proximity to major airports in Europe. According to Fall, prior to COVID, tourism made up about 10% of the Senegalese GDP and employed about 150,000 people, or 9% of total employment. But there were always trade-offs.
So one of the biggest ones, the most important for me, is just a lack of correlation between this tremendous growth in interest in international tourists coming to the country and the actual poverty level or the human factor in terms of, are the people getting a better education? So the United Nations has an index that captures well-being in a country, and there just doesn't seem to be a correlation between the two. So that begs the question, the dividends from this tremendous interest in tourism, where does it go? Does it really benefit the people? And I think it's really at the center of the research that I've been conducting.
Fall also notes that many tourists coming to Senegal stay in all-inclusive resorts, meaning they're not spending money locally. Plus, the industry takes an environmental toll as well.
The average tourist uses a lot more energy and a lot more water than your local, Senegalese person. So if you're a local person, you see your environment resources being utilized and you don't really see any economic benefit from it.
COVID-19 caused an abrupt stop to international tourism and hit Senegal hard. Hotels went bankrupt, and Fall said that many development projects that were in the pipeline were abandoned without any timeline as to when they'd be started again. The situation has caused particular hardship for young Senegalese citizens who have lost opportunities for education and training. But Fall says that the pandemic may have created the disruption needed to rethink the tourism industry in Senegal.
I think that new hotel projects need to focus really on low carbon emission. They need to focus on environmental preservation, solidarity, social justice, a big emphasis on the trickle-down aspect to local economy. How does the local person really benefit from all this people coming in? And also tourism that's culturally meaningful. So I think that, really need to focus on those pillars.
An industry that's more resilient to climate change, more environmentally minded, and that puts tourism dollars directly into the pockets of locals is one that could potentially survive future pandemics. In a way, says Fall,
they need to really adopt a new paradigm. Think of post-COVID-19 as really year zero of tourism, of the new tourism.
COVID-19 was devastating for the tourism industry in many ways. According to the World Economic Forum, the industry lost $4.5 trillion in GDP and 62 million jobs in 2020 alone. But as vaccinations and immunity levels rise, recovery and change does feel possible.
Travelers are certainly eager to get back out there. But for some of the most popular vacation destinations, the new tourism may mean cracking a window, not opening the floodgates. I'm Annalise Winnie.
And I'm Lindsay Smith-Rogers. Thank you for listening to this special episode of Public Health in the Field.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.